Another scientifically inaccurate and potentially harmful statement made by another celebrity about health. It's no surprise, but we're talking about it on this week's Wednesday Checkup. I found out last week that Lady Gaga sat down to have an open and honest conversation with Oprah about her mental health. This conversation talked about her own journey, breaking the mental health stigma that exists, and addressing disparities. Now, all those things are incredibly important, and I'm actually really passionate about addressing those issues. In fact, many of my patients who are uninsured or only have catastrophic insurance, they face a really tough task in finding a mental health counselor, therapist, psychiatrist, and it's my job as a family medicine doctor to not only fill that void, but also help them navigate this really tricky system that we have here in the United States. When it comes to mental health stigma, this absolutely needs to be broken. But in order to break the mental health stigma, we need honest and accurate information. When we talk about someone having a mental health issue, that's not to say that they're weak. It's not to say that there's something wrong with them. But diagnosing ourselves is not the solution. Reading a book and saying, oh, I must have X, Y, and Z, and now I need to self-treat myself also is not ideal. The most ideal way to go about getting proper mental health treatment is A, to see a licensed therapist, psychiatrist, or primary care physician. And I say primary care physician because there was a specific segment within Lady Gaga's speech that is harmfully inaccurate. By the way, if your primary care doctor is prescribing you an antidepressant, this should not be happening. Primary care doctors should be introducing you to a psychiatrist, an expert in brain medication. Now, as a primary care doctor, a board-certified family medicine physician, my problem with this statement is not personal offense. Lady Gaga did not offend me by saying this statement, but what she is saying is scientifically inaccurate and it's wrong factually. Let's start off on a practical note. Let's talk about the numbers. The National Institutes of Health estimates that 1 in 5 adults will have a mental health issue. When I say issue, a classifiable mental health disorder. That equates to about 40 to 66 million individuals with a condition. Now, there's only about 20-something thousand practicing psychiatrists in the US. How are all those people gonna get care? And on top of that, there's certain geographic limitations where there are no practicing psychiatrists in a given area. Then there's people who have lower socioeconomic standing who are uninsured and have higher rates of mental illness. What are they supposed to do, Lady Gaga? Second, we don't want to put even more stress on our overburdened mental health care system. Think about this. Psychiatrists are specialists in what they do, and they should be seeing more complex cases. If every single time any patient that needed antidepressant needed to be referred to them, think about the incredible wait times that would create for patients who are truly complex and can't be treated by family medicine doctors. This will completely break our already nearly broken system. In fact, psychiatrists and other specialists that I've worked with in the past have sometimes laid the complaint at my feet that some family medicine providers are too quick to refer instead of trying first-line treatments like antidepressants. And I completely agree with that, which goes completely against what Lady Gaga was trying to say in this speech. 3. Board-certified family medicine doctors receive extensive education and training in mental health conditions and brain medications with the ability to refer or triage as needed. In reality, it's the actual job of the family medicine doctor to be able to administer first-line and even second-line treatments before sending the patient to a specialist. If you try the first-line treatment, it fails. Maybe you try the second-line treatment, it fails. Then you need a specialist. If you need to perform a procedure that you're not trained in or you don't have the equipment to perform, you need to send to a specialist. If you've come across a complex case with a patient having more than one illness or taking more than one medication, that could be high enough complexity to warrant a referral. Perhaps you're not comfortable with the specific illness that the patient has and you don't have enough experience with it. That warrants a referral. But these are the minority of cases. The huge majority of patients with anxiety and depression who warrant antidepressants can and should be treated by primary care doctors. Also, as a side note, not every patient with anxiety and depression needs antidepressants. And in fact, that's the beauty of family medicine. We understand that cognitive behavioral therapy, DBT, all these options work very well for our patients. And because we have existing relationships with these patients, because we're their primary care providers, we treat them for years, we know what works. We know what medications they do well with. They have direct access to us. And it only makes sense that we continue this line of treatment until it passes that complexity line where we do need to get a specialist like a psychiatrist involved. 4, I think there's a faulty mentality at the heart of this statement, where more money spent always yields better care or outcomes. And that's just not the case. In reality, I have many celebrity or wealthy patients that come in to see me that request every single test or every single treatment. And I have to explain to them that tests come with possible risks. Treatments come with possible risks, even though some of them may seem completely benign, like a blood test. And we need to have those conversations. Now, you may be wondering to yourself, how is seeing a specialist putting me at risk? Well, it's not directly putting you at risk because specialists are very competent, they know what they're doing. But from my experience, what I've seen is if a patient who does not have a primary care doctor gets sent to a specialist too early, they sometimes get treatments or even tests for things that they don't need yet. This is not because the specialists don't know what they're doing or because they're trying to push things onto the patient. It's because they're used to seeing more complex cases. So they have a lower threshold of when to order certain tests or certain treatments. And they don't have existing relationships with these patients like we do as primary care providers. For example, I have some patients that when they come in and they say their pain level is a 4 or 5, I get really worried because I already know they have a very high pain threshold. But if they go see a cardiologist and they say, oh, my pain's a 4, maybe it's not taken as seriously. If you jump onto any review site, you'll see patients complaining that they didn't get tests or treatments from their doctor and they think that's a bad thing. But I recently came across a tweet from a Dr. Christina Johns that I think works very well in this case. It reads, just because no tests were performed or medicines prescribed, it doesn't mean that you didn't get care. I completely agree with this statement because it takes careful evaluation to know what a patient has, to weigh the risks and benefits of each procedure and each treatment and figure out what's right for the individual sitting in front of you. That's why generalizations don't work well in medicine. And that's why Lady Gaga's statement here does more harm than good at the end of the day. It puts patients at risk who would otherwise go get care from a family medicine doctor. It hurts existing doctor-patient relationships that are potentially going very well. I guess the final thing that really makes a statement inaccurate is that pretty much every medical organization agrees that family medicine doctors are more than capable and are trained to prescribe antidepressants, to know when to refer patients if the complexity arises, and to make a universal statement like that disagrees with all of medicine just doesn't make a lot of sense. Just 4 days ago, the active president of the AFP, Dr. Leroy, made a great statement. Family medicine physicians are on the front lines of mental health care in America, and I completely agree with that statement. Do you know why? I would actually go as far as to say 80% of my visits, there is a mental health care component. So when a patient comes in for back pain, acid reflux, diabetes, chronic care management, those usually have a mental health component in them, whether we see it or not, whether we diagnose it or not. And if we're gonna go ahead and make a universal statement and say family medicine doctors shouldn't prescribe antidepressants or they're incapable to take care of mental health, it's just flat out wrong. I'm dropping some great resources down below, including a response from the American Academy of Family Physicians and a fantastic open letter by Dr. Megan Babb on the subject. I encourage you to read it. A lot of the same points I brought up in this video were addressed in her letter as well. And we really should send a message to Lady Gaga and really all influential celebrities out there. Your message is gonna be heard by millions of people. They're gonna trust you because you're a familiar face. They have respect for you. So if you're gonna be making universal recommendations about healthcare, please, please partner with a medical organization, partner with a medical professional before more harm than good is done with those statements. If you're interested to watch some of my other videos about mental health, which I'm very passionate about as an osteopathic and holistic physician, click here. As always, stay happy and healthy.